Hi everyone. So today we'll be discussing about something that's called as space maintainers. Now see, we all know that children have two sets of teeth, or any human being for that matter has got two sets of teeth. In childhood they have their primary set of teeth, and once these primary set of teeth fall off, they have their permanent set of teeth. Now it's a normal process of primary changing into permanent set of teeth. But it so happens that the primary teeth or the milk teeth fall off before their time is due to fall off. So then arises the situation wherein there is a period of time when the space is blank and the permanent counterpart or the permanent teeth in that area is yet to erupt. It has not yet erupted. So in that situation, there will arise the role of space maintainers, because body has this tendency of closing up this any blank space. For the body to not to be able to close that blank space which was left because of the early exfoliation of primary teeth, we require space maintainer. Now, what is it? As I mentioned before, it is a device that is used to hold the spot or the space that has been left by baby tooth or the milk tooth because it was exfoliated early, or because of any reason it had to be taken out early. That can either be because of decay or because of any trauma or injury because of which the tooth avulsed or the tooth came out. So this particular appliance, it helps to keep the space available till the permanent tooth emerges into that particular space. Now, why is it needed? Again, as I mentioned before, body has this tendency of closing up the space, so the adjacent teeth will move into that space and close that space. If that space is closed, obviously we know that the permanent teeth that had to erupt in that area will not get enough space, and it will erupt otherwise. It will cause crowding, it will cause malalignment, it will cause, it will be difficult, it will erupt in some other position, so it will be difficult later. Again, see, usual time period when your permanent teeth is erupting in a normal process wherein the primary teeth have fallen off in their normal time. Yes, within 4 months, 2 months, the permanent teeth will erupt. Then space maintainer is not required. A space maintainer is required only when the primary teeth or the milk teeth have fallen well before their time. Let's say your incisors, your lower front teeth had to fall off by 5 years of age or 6 years of age, and they have fallen off at 4 years itself or 3 years itself, when the child was 3 years itself only. Then in that case, you need to keep the space maintained, because what happens when the permanent tooth I'm talking about, when the primary tooth has fallen off well before its time, we need to save the space more so, because then the permanent counterpart also, its eruption is delayed. So both of it has happened. As it is, the primary tooth has exfoliated before time, because of which the permanent counterpart also, its eruption will get delayed. So to maintain the space for that delay, and also to maintain the space for that permanent tooth to come, even if there is no delay in its eruption, a space maintainer is required. And for that matter, the best space maintainer is the primary tooth, because as you can see in the picture, the primary tooth in itself serves the purpose of maintaining space for the permanent tooth to come up. Okay? Because obviously the primary tooth is just serving the purpose for a few years. It is eventually and finally the permanent tooth that will serve the purpose and will be there in your mouth for the rest of your life. So it is actually a space maintainer itself. But since we're discussing about space maintainers and I told you that it's a device, so yes, what are the different types of space maintainers? We'll discuss about them in our upcoming part. That will be part 2. Till then, take care. Thank you. If there's anything particular you need to know about, do let me know in the comment section. Bye.